Today, we're going to pull back the curtain on a topic that affects so many of us: gynecological cancers. Our goal here is simple: to swap out all that confusing medical jargon for some clear, straightforward knowledge. Because let's be real, understanding our own bodies is the absolute first step in taking control of our health.
All right, so here's our game plan for this explainer. We're going to start from the outside and work our way in. First up, tumors of the vulva. Then we'll dive into the cervix and the incredible power of screening. From there, we'll move inside the uterus, touch on some rare pregnancy-related tumors, and then we'll wrap it all up with the biggest, most important takeaways.
Okay, let's kick things off with tumors of the vulva. And right off the bat, the most important thing for you to know is that these are not common. That's a really crucial piece of context to keep in mind as we get into the details.
So just how uncommon are we talking? Well, these tumors only make up about 4% of all cancers in the female genital tract. It's a small percentage for sure, but if you're affected by it, understanding it is everything.
The most frequent type you'll see is a skin cancer called squamous cell carcinoma. And what's interesting is that it really has two different stories. One path is linked to HPV, usually showing up in younger people, and smoking is a big risk factor. The other path, which is actually more common, has nothing to do with HPV. It's more often seen in older individuals who've had long-term inflammatory skin conditions.
Now, the symptoms are often pretty clear. We're talking about things like persistent itching, a lump you can feel, pain, or even an ulcer. These are signs that usually make someone say, okay, time to see a doctor. In a lot of cases, these things are pretty obvious clinically, which is a huge help for getting an early diagnosis.
But, while just looking is the first step, the final definitive answer always comes from a biopsy. A tiny piece of tissue is taken and looked at under a microscope. That's the only way to get a 100% confirmed diagnosis and to really understand what's going on at the cellular level. All right, next up, let's talk about cervical cancer. This is such a powerful story about how effective screening can be. We're talking about actually preventing a disease before it even gets started.
So, get this. The connection here is incredibly direct. HPV is a super common virus, but a few specific high-risk types are responsible for nearly every single case of cervical cancer. That discovery was a total game changer, and it completely revolutionized how we approach prevention.
Long before cancer ever develops, the virus can cause the cells on the cervix to become, a little abnormal. This precancerous stage has a long name, cervical intraepithelial neoplasm, but we just call it CIN. All it really means is that the cells are growing in a disorganized, messy way, and that is exactly what screening programs are designed to find. You can kind of think of this as a slow progression of disorganization. With CNI1, just the bottom layer of cells is affected. In CNI2, it's spread to the bottom 2/3, and by CIN3, the entire thickness of that surface layer is showing this messy growth. The beauty is, catching it at any of these stages lets doctors treat it effectively, long before it has a chance to become invasive cancer.
And that brings us to the Pap smear. This incredibly simple test just collects a few cells from the cervix to look for these changes. By catching and treating these abnormalities early, we can stop them in their tracks. The impact has been absolutely massive. In countries with widespread screening, deaths from cervical cancer have dropped by as much as 80%. It's a true public health success story.
So what happens if a smear test comes back abnormal? Well, the next step is usually a colposcopy. It sounds like a big deal, but it's really just a procedure that uses a special microscope to get a magnified view of the cervix. Doctors use some clever tricks like dabbing on a solution that's basically vinegar, which makes abnormal cells turn white. They can then pinpoint exactly where to take a tiny biopsy to get that final diagnosis. Okay, let's move a little deeper into the body now and talk about cancers that start in the endometrium. That's the lining of the uterus.
And just like we saw before, endometrial cancer isn't just one single disease. The huge majority, we're talking 90%, are what's called type 1. These are linked to estrogen, tend to happen in pre- or perimenopausal women, and thankfully they usually have a really good prognosis. Type 2 is way less common, isn't driven by estrogen, affects older women, and unfortunately it tends to have a poorer outlook.
And here is a hugely important statistic. A full 90% of patients with endometrial cancer will have one very specific symptom: abnormal vaginal bleeding. This is a massive warning sign.
This quote really says it all. It's basically a golden rule in medicine. The message you'll hear from doctors everywhere is that bleeding after menopause is never normal. It always, always needs to be checked out to rule out something serious like endometrial cancer.
The way doctors figure this out is super methodical. It starts with a transvaginal ultrasound to measure how thick the uterine lining is. If it's thicker than it should be, usually over 4 millimeters in a postmenopausal woman, then the next step is a biopsy. And if that confirms cancer, an MRI is used to get a really detailed map of the disease stage and see if it has spread. Now for our last category, which is a really unique one. We're going to talk about a group of rare tumors that are actually related to pregnancy, known as gestational trophoblastic disease.
Okay, so the most common form of this is something called a hydatidiform mole, or a molar pregnancy. Essentially, it's an abnormal pregnancy where the tissue that's supposed to grow into the placenta just goes haywire and grows out of control. In what's called a complete mole, there's no fetus at all, just a mass of swollen tissue. In a partial mole, there might be a non-viable fetus, and only parts of the placenta are abnormal.
And here's a pretty memorable visual clue for diagnosis. The classic sign on an ultrasound is what doctors call a snowstorm appearance. You can just picture it, right? This distinct, swirling pattern is a really effective way for doctors to spot a complete molar pregnancy.
So, treatment involves a procedure to remove the abnormal tissue from the uterus. But, and this is a big but, the follow-up here is absolutely critical. Patients have to have their levels of the pregnancy hormone, HCG, monitored very closely to make sure no abnormal cells are left behind. That's because in a small number of cases, those cells can stick around and turn into a cancer called choriocarcinoma. So that careful monitoring is essential.
Wow. Okay, we have covered a ton of ground, journeying from the outside in. So let's pull it all together and go over the most important takeaways from all this.
First, these cancers are not a one-size-fits-all problem. They are incredibly diverse, with different causes and risk factors. Second, our bodies often give us really clear warning signs, like bleeding after menopause, that should never be ignored. Third, we have amazingly powerful tools, like the Pap smear, that can literally stop cancer before it even starts. And finally, just knowing that diagnosis is a logical, step-by-step process, that knowledge itself is power, and it can help us be active partners in our own health.
So I'll leave you with this final thought. The fact that we can find and treat these conditions before they even become invasive is a monumental achievement. It completely shifts the focus from just reacting to disease to actively preventing it. It really drives home that routine screenings aren't just about finding cancer. They're about stopping it from ever starting in the first place. Thanks for joining us.